Good afternoon, everyone. This is Tony Trahan with the Office of Mental Health. Thanks for coming today on this webinar about how to work and win. Just for folks who have not been to a webinar before, just a brief orientation. Due to the number of people that we have attending, well, we do have to keep the lines muted, so you are in listen-only mode right now. However, we do want people to feel free to ask questions via the chat function on the webinar control panel. I will show you how to do that for people who aren't aware of it. So as you can see where the arrows are, if you just click on where it says question and answer, that will open up the box and you can just enter the question for the staff. I will be monitoring the chat box throughout the webinar. You can ask questions at any time. If you have a particular question, if you could just note the page number about it, so that way we can refer back to that slide. So if you could just put that in your question, that would make things a lot easier. And then in order to close the control panel, so you'll be able to see the whole screen, just where you see the arrow pointed, just press that little arrow that's pointing to the right, and that will minimize your screen over to the right-hand side of your computer. And then to open it back up again, you just press that arrow again. This time it will be pointing to the left-hand side, and that will maximize it. And then you can get to the chat function that way. And while I'm continuing with our introduction, let me just change the presenter over, make Douglas Drew the presenter, and so you'll be able to see his screen. All right. This webinar is going to be recorded, and it will be archived, and you'll receive the link to the archived version in a follow-up email. Please feel free to share that link with other people in your agency or anyone that you think might be interested in this. We currently have 150 people on the line right now. When the webinar ends, you will receive a short survey. If you could please take the time to fill it out. Everyone attending will receive a certificate via the email. And if people are sharing a computer to view the webinar, please list all the people requesting a certificate, and they will all be sent as attachments to you in one email. And I do want to apologize for anyone who's still expecting certificates from some previous webinars that we've done. We are very behind on that, and I am sorry for that. If you need a certificate immediately for any kind of certification, like a CPRP certification or anything like that, just shoot me an email, and I will get that to you expeditiously. So for today, on employment. A recent study from Mathematica has shown that employment is one of the best ways to reduce reliance on services and to manage symptoms. We know that between 50% and 70% of adults in New York State who receive services in the mental health system say they want to work, but no more than 15% actually have jobs. Supported employment is a SAMHSA-recognized evidence-based practice. We've learned that current active symptoms are not a factor or a good predictor for successful employment. So why have we as a system done such a poor job in helping people get and maintain jobs? Certainly one of the problems is a complicated bureaucracy related to how employment affects benefits like SSI, SSDI, and Medicaid, and people are reluctant to risk losing these resources, especially if they have waited years to be approved. Today's webinar will help you understand some of the most common yet underutilized work incentives that are available, as well as some, and hopefully challenge some ideas about how people with psychiatric problems or with mental health issues or who use services can get employment and whether or not they can be employed. Douglas Drew is our presenter today. Douglas has served as the Regional Advocacy Specialist for the New York State Office of Mental Health for over 9 years at the Long Island Field Office. Doug has served on the front line in local advocacy and case management roles for the previous 9 years. And the heart of his work is demonstrated in presentations such as How to Work and Win, like this one today, believing that all people OMH serves have the capacity to work and earn and create a meaningful life independent of the mental health and social service system. And just on a personal note, I have a great deal of respect for Doug. Doug was very proactive in requesting this to do this webinar for us today, and I really, I admire him, and I consider Doug a role model. He's really inspired me a lot, and I thank him for doing this for us today. Doug, I turn it over to you.
Well, great. That's a really nice introduction, Tony. I really appreciate that. So that's terrific. Tony's been great too. He's, without him, certainly we can't do these webinars, but he's done so much more, certainly for our Bureau, Office of Consumer Affairs, and we owe him a lot. So thank you, Tony. So thank you. Good day, New York, or good afternoon at least. I'm really happy to be here today, and I hope this presentation meets your needs. I have been proactive in pushing us to get this information out. I've been inspired to do this because I've been frustrated with the information that's out there about work incentives and how people who rely on Social Security, SSI and SSDI, don't know enough about what the work incentives are. That most people, as Tony said, do want to work. I would even say that the numbers are even higher. I would say the vast, vast majority of people in our system want to work. And we know that because when we ask the right questions, and it's the questions that are important, how we ask those questions, that people identify, yes, I do want to work. I want to work. Not everybody believes they can do it right now or here, or in some ways ever think it's possible, but they do have a desire to work. So I'm going to press that button again and again during the presentation. You'll hear me doing that. So let me give you a brief overview of this presentation. I've developed this very brief pamphlet, which I'll show you in just a moment. It's 8.5 by 11 pamphlet. The information fits on easily on it in a two-sided format. I wanted it to be a straightforward reference. It is not a complete reference of work incentives that Social Security offers or New York State offers. It is an overview, and that's what this presentation is, an overview of some of the main Social Security New York State work incentives that are out there. My main goal really today is that the information is accessible, and if we present it in the right way, people will understand it. And that's where I came up with these 5 rules of thumb. And I'll go over them just shortly, and we'll get into details on them. The first rule, people with psychiatric diagnosis can work and earn an independent living. It's happening all the time. Rule 2, earnings from work can and do affect cash benefits, but that's not a bad thing. We'll tell you why. Social Security, number 3, Social Security will invest money in people's future potential to work and earn. A lot of people don't take advantage of these programs, and I'll tell you about 2 of them. Number 4, there is low cost or even no cost in many circumstances health insurance available for folks, and this may be the biggest obstacle for people getting back to work is health insurance. Number 5, if you want to work, and this is the big message, right? If you want to work, I want to tell people to go for it. Go for it, go for it, go for it. There is a safety net behind you, and somebody pointed that out in the comments before the webinar about the network. It's really a net, safety net that Social Security provides, and I'll get into discussing that. So the other part of this message you'll hear again and again is be thoughtful. This is a thoughtful process. If you're thoughtful and you know this information and you get to learn this information, you don't have to worry about your benefits. So many people are concerned, and this may be one of the big obstacles, the biggest obstacles for people going back to work is what I like to call benefit anxiety, the fear of losing benefits because of earnings from work. And my goal here today is to tell you that you don't have to worry. If you're thoughtful about it, you don't have to worry. In many circumstances, this presentation is not about how to keep your benefits while you go to work. This is in some cases, in many cases maybe, how to lose your benefits and to do it without pushing yourself over the edge and with worry and anxiety about this. So that's where we are. So again, if you want to go to work, go for it. I'll share some basic resources that people can use, call. especially my coworkers around the state. Heads up, guys. We get some phone calls. I understand we got a very good response to this, and I hope my coworkers get some of that, some of those phone calls from you guys. Okay, so let me show you the. There's a little delay on my screen to your screen, but I'm going to show you the pamphlet that I came up with that came with the presentation. So hopefully you've been able to take a look at it and maybe even print it out. It would be great if you could print this out in color. It's certainly supposed to be eye-catching and get people's attention. But basically, it's again, it's a very short reference guide. What's special about the electronic version, this PDF version that you have, I'm showing you right now, is that it's entirely clickable. And what I mean by that is if you're on the computer, you can click, you can see the front and the back pages here. You can click any of the links to any of the resources. And just for argument's sake, let's just try one, and it'll take a second on your end. But I'm bringing you right to the Social Security web page on the Red Book. And this is a guide that I'm going to be referring to and throughout this presentation, and maybe even thumbing through it as we go through the presentation. But I'm going to go back to the pamphlet now. This pamphlet is entirely clickable. So even within the body of the pamphlet, as you're reading through and you see a work incentive, a specific work incentive like a trial work period, you can click on the link and it'll bring you directly to Social Security's website, web page on that work incentive. So you don't have to go scrambling through the Social Security web page looking for this information. These links will bring you directly to that information. So I tried to make it as easy as possible for people. So okay, enough said about the pamphlet. The pamphlet is the presentation, by the way, but let's get into that. So let's jump into those rules. Rule of thumb number one, and I may spend a little time on this because this is maybe the most important. You can, people with psychiatric disability diagnoses, labels, what you call it what you will, people can work, and we know that because people are doing it all the time. People are diving into work and making it happen, making it work for themselves. We know this historically. We know that people can work. And just to give you an example, and John Allen, the director of the Office of Consumer Affairs, has enlightened us on the history here of it. We know 100 years ago in the mental health system, if you were in the mental health system, you basically worked. Everybody, every able-bodied person worked. And we know, unfortunately, people weren't paid, unfortunately. So laws changed and attitudes changed, and we went from everybody working to nobody working because there was no pay. We suffered with that sort of mentality for a good, 80 years. It's only the last 20 years or so that, the idea of people creating meaningful lives for themselves and going back to work has been thought possible. But it's still a struggle. We still sort of suffer from that mindset. There are a lot of, and I'm going to go into this a little bit, a lot of people out there who don't know that work is possible and have bought into the message that it's not. And so I just want to read a little bit right from the pamphlet. It's about why it's important to work and what could be a motivating factor. And this is another message in the presentation. When you're earning through work or business, you're always ahead. You're always ahead. And in the short and long term, making a living through work or business, because a lot of people open their own businesses, can offer more benefits than public assistance ever can. And I say that it's the possibility of such, because the harder you work, the more these possibilities arise. So the benefits include the possibility of more daily living choices around housing, transportation, food, hobbies, entertainment, better medical benefits, a growing savings account, travel, a retirement pension, the ability to take care of family, give to charity or give extra to charity. There's so many reasons that, so many incentives to go to work. and live a really better life than you ever could on just the SSI, Social Security, Supplemental Security Income, or SSDI, Social Security Disability Insurance. Work offers all those many more benefits. You know, people have, more than anything, their own reasons to go back to work. I can't talk enough about why people should go to work, but people have their own reasons to go to work, and most of it is because people will have more control over their lives, and you know, so people know why they want. And I say that again, that the vast majority of people in our system do want to work in some way. People do want to work. I know people. Another possible reason for people to think about work is people want to give back to the system that gave to them, and perhaps the best way of doing that is to go to work in some way. You can work, yes, in the social service, the mental health system, the human service system. That's a great way of giving back, or giving time back. But just working in general is a great idea as well, because you become a taxpayer, and taxes are what pays for these services. So you're giving back through that means, through being a taxpayer. You're giving back to the system, making the services that helped you available to future people in need. So just a couple of thoughts about that. I should put this in presentation mode. So rule of thumb number one, and I'm going to ask for feedback on these two questions. This is a sense of the mindset that we still, to some degree, maybe a much lesser degree than just a few years ago, but to some degree, people are still hearing these negative ideas about work and their capacity to work. So I'm asking people in the audience to give a little feedback. Has somebody ever told you you can't work? And let us know who. Is it a doctor? Is it some sort of clinician? Is it a housing case manager? We've heard all of these things. Just last week I was surprised to hear that people are in one program are being told, well, if you work, your rent is going to go up because you live in supported housing. And that's an unfortunate message. People should never be told that they shouldn't work. And we're trying to combat that in all sorts of ways. And we'll get into that a little bit. But I would love feedback on that question. But with that negative mindset, from the message from some of our recalcitrant people in the system, have you convinced yourself that you can't work? Is that something, I've heard feedback certainly on that people have bought into that message that, you know, you have this diagnosis, you have this label, this illness, that means I can't work. But that's what we're trying to find out. Have you convinced yourself that you can't work? We'd love feedback on that. So I'll move on here. Rule of thumb number two. Rule of thumb number two. Earnings from work can and do affect cash benefits. But that's not a bad thing if you're thoughtful about it. So that's where I'm back to the thoughtfulness about this. In many ways, this presentation is not about how to work and keep your benefits. In some ways, and this is entirely up to you as an individual to work this out for yourself, but this is about, in many cases, getting off benefits because of the power of work and how it can enhance your life. So this is not necessarily about simply working and keeping benefits. Although there are some exceptions and ways to maintain the most important benefits, which I'll get into. But Social Security really does want to see people work, so they do offer these work incentives. Now, the Red Book I was referring to before has many more details about these work incentives, and I would encourage you to take a look at that. The links are in the booklet. I'll show you again. Let me find that. This is what the Red Book looks like. I don't know if it takes a second, but this is what the Social Security 2012 Red Book on work incentives look like. A guide to work incentives look like. It has all the details about these work incentives in there. Take a look at that. I struggled a little bit what to include in the book, in the pamphlet. And I couldn't include everything. I tried to include the most important ones. So let me go back to the presentation here. So I want to talk about two types of work incentives. one for SSI recipients and others for SSDI recipients, because they're a little bit different. Now, there was a question early before the conference, is it possible to receive both SSI and SSDI benefits? And the answer is yes. And in that case, and for people who do have received benefits, cash benefits from both SSI and SSDI, you have to think about both of those, all of those work incentive issues. Again, I don't want you to worry about these things. The information is there. You can find it. I'm making hopefully easier for you to find it. I don't want you to worry about it. I want you to be thoughtful about it. So let's go into some basic rules about how cash earnings from work will affect benefits for SSI recipients first. Let me go to the next slide. So my message is be thoughtful and do the math. And I'm not going to get into the math right now, but what I really want to say is it's relatively easy for SSI recipients to figure this out and to ease off benefits or understand this. So whether you're earning $100 a month, $200 a month, $400 a month, $800 a month, or $1,600 a month, you'll always be ahead. You'll always have more money in your pocket than when you just had the SSI alone. So yes, I want to tell you, the more you work, the more that your SSI check goes down. And there's math out there, and in the Red Book, the specific formula to figure that out is there. But even if you feel like you're losing, and it feels like you're losing something when your SSI check goes down, but in actuality, you're not. You'll have, in many cases, way more earnings than you did with just the SSI check. And I'm going to give you an example. This next slide. Give it a moment to come up. Again, be thoughtful. So the example is Bob. He receives the single live-alone rate in New York State. That's the federal benefit rate plus New York State supplement to SSI. That's $789. And the example I'm using is he has no other income. In other words, he doesn't have any earnings from anywhere else, whether it's another benefit like SSDI or veterans benefits or anything like that. He just has the SSI, just to keep things simple for this presentation. So as an example, Bob is earning $100 a month. There is math to do, but what this means for Bob's SSI check is that check is decreased by $7.50. And it feels like a little bit of a loss. It's not a big loss. But after we do the math, we find out that Bob's total monthly income is $881 a month, which, unless people disagree with me, is more than $789 a month. And I would love to hear that if you disagree with me. So let's go to the example of Bob starts earning $400 a month. I'm just going to skip a little bit. Bob has now worked his way up at a certain business, and they like him. They've brought him on for more hours, and now he's earning $400 a month. Now, with this, his SSI check is being decreased by $157. Now that feels like a little bit more of a loss. He's losing $157. That can pay for food and transportation and a lot of things. But in fact, again, he's ahead. He's ahead more and more than he was with just the SSI check. Now his total monthly income is $1,031.50. Okay, and again, I'm going to use skip one of the examples. Now Bob is really earning money. The company really likes the work he does, and they hired even more hours. Now he's earning $1,600 a month, and his SSI check is decreased to almost zero. But he still has some. He still has about $31 in SSI, and it feels like a big loss. $757 is a big loss, it feels like. But in actuality, again, his total monthly income is $1,631. That's way, way more. So more than double what he had in SSI payments alone. I think you would agree that it's more money than he did have beforehand. Okay, so that's my message, is that, especially for SSI recipients, the work incentive is fairly straightforward. Now, what allows an individual to maintain SSI even after earning more than what Social Security calls this substantial gainful activity, which is $1,010 in 2012, is a provision, a work incentive called special SSI payments for persons who work, Section 1619A. Allows people to maintain the benefit, the cash benefit, and earn more than SGA. I want you to look into the Red Book and look at the details of that and what that means for you. But that's the basic information there. Okay, so I'm going to go back a couple slides here, and I want to talk about the work incentive that's available for SSDI recipients, Social Security Disability Insurance recipients. Your basic benefit that everybody, many people have heard about and maybe don't really take advantage of is the trial work period. That's the main, the big benefit, work incentive that's available to SSDI recipients is the trial work period. It allows an individual to really test their work and earning skills. It allows an individual really to make as much as he or she wants without any limits and still maintain all their SSDI cash benefit. And there's a little bit of leeway after the 9 months available too. But if you have a way of earning $1 million a month during this trial work period, go for it, because you'll be able to, one, test your skills, and two, maintain your SSDI benefits. Let me see, I'm missing one thing I want to say about this. Oh, the trigger. What triggers a trial work period? That's important. Once you start earning more than $720 a month work earnings, you trigger a trial work period month. Now, these trial work period months are not necessarily consecutive. So if you're making $780 in February, you've triggered a trial work period. If you make $700 in March, you haven't triggered a trial work period. Now, this is assuming you still have a trial work period, because many people have used their trial work periods without even knowing it. They've earned $700, $800, say $800 a month just because they can, and they haven't really thought about what the trial work period means to them. But my suggestion, my advice to people is that be aware of this limit, because the trial work period is really an opportunity for you to test your skills out, test your stamina at work over almost a year's period of time. And so if you're going to earn more than $720, I want to suggest that you really go for it. Really test your skills. If you have a way of making much more than $720, really go for it, because this is your opportunity to test your skills and see how much stamina and energy you have and will you have to really do this. Okay, so that's the basic SSDI work incentive that I'm going to talk about in rule of thumb number 2. But again, yes, cash earnings do affect cash benefits. Be aware of that. And I'm going to go into this a little bit later, but always let Social Security know when you're earning your income changes, whether it's through work or anything else. Let people know. Let Social Security know specifically. They're going to find out down the line anyway, and you don't want to get caught up with an overpayment. They're messy, they're ugly. Small ones can be dealt with fairly easily, but I've heard of people having $20,000, $30,000 overpayments, and how crushed they were to find out that they owed Social Security. It's like paying a mortgage without having a place to live. Don't get caught in an overpayment. Let Social Security know that you're working. Let Social Security know how much you're earning. They may not be as quick as you want them to be in terms of recognizing it, but let them know, and you'll have your back covered. Okay. This is the rule. Be thoughtful. This is where I want you to be thoughtful again. Always report income changes to Social Security. Okay. All right. Rule of thumb number 3. Social Security will invest in your future, in your potential to work and earn. I think people know about some of these programs, but they're really, really underutilized. I'm not going to go into details with these programs too much. There's just two. One is the Plan to Achieve Self-Support, commonly called the PASS, and that's for SSI recipients. It allows you to save money and maintain SSI cash benefits, so you can skip the math that we talked about earlier. You can earn money and maintain your SSI cash benefits. And while working on this plan, and it is a plan, it's a thoughtful plan that you have to put together, there is help out there. On your resource page, in the back of your pamphlet, there is a number of resources that you can go to, including the Work Incentive Planning and Assistance Outreach people working for Social Security that can help you draw up a PASS plan. But it's a great way of earning and saving money to help pay for education, training, to start a business, in some cases buy a car. And again, it is a thoughtful process. It is a somewhat complex process, so but you don't have to do it alone. There is help out there to do that. Even this PASS plan is available to some SSDI recipients, can become eligible for PASS. I'm not going to get into the details of that, but there's a way of putting some of your SSDI cash benefit into a PASS plan that could make, in some cases, you eligible for SSI benefits. So there's a way of accessing the PASS plan for SSDI recipients. Okay. Again, look in your Red Book. That's where more detailed information about the PASS plan is available. It's a great thing. It's worth thousands of dollars, potentially. Now for another work incentive that I want to talk about, and another perhaps even more underutilized program, is called the Ticket to Work. And this is available for all SSI and SSDI recipients. This ticket that you should have received in the mail is worth approximately $23,000. And when I tell people are stunned. What, $23,000? Well, so many people are leaving $23,000 on the table because they don't know it exists. And it's available to people through what Social Security calls approved providers called employment networks. Once again, the resource to look into this is available on the resource page of the pamphlet. There's a website and a 1-800 number that's available for people to call and find out how to make use of this ticket. I think the numbers that we were given was at less than 5% of people who are eligible for Ticket to Work services are using it. So 95% of people are not taking advantage of $20,000 in services. Would you voluntarily leave $20,000 on the table? It's hard to believe that you might, but it's there for you. Take advantage of it. Look into it. Okay. Rule of thumb number 4, and maybe you're moving too fast. Tony will let me know if I'm moving too fast, but if I should answer some questions. Rule number 4, low cost or even no cost health insurance for workers is available. And this may be the big sticking point for many people is fear of losing medical insurance. We know that psychiatry isn't cheap. Medicines alone can cost hundreds and thousands of dollars and easily put people in bad situations when they have to choose between medications and rent or food. If you're working, Social Security and New York State in this case offer work incentives that are available to you. The 3 that I'm going to talk about here, for SSI recipients, you have a provision called Medicaid While Working, an incentive called Medicaid While Working, Section 1619B. It allows you, and this is an automatic, if you have SSI benefits and you start working, this benefit is automatic. You shouldn't have to think about it even. But it allows you to earn up to $46,000 and $46,318 a year for a single person in New York 2012 and maintain Medicaid benefits at no extra cost to you. $46,000. Now we know that we're not living in East Hampton on $46,000, but that's not bad, $46,000. That's not a bad living. So that's a great benefit that's available, and it's automatic for SSI recipients. For SSDI recipients, you have available to you a continuation of Medicare coverage and a Medicare for persons with disabilities who work coverage. You know, in many cases, and I'm going to try to get the details. I'm going to thumb through the Red Book because that's what it's there for. I don't have to memorize all this stuff. I can look it up. So just bear with me a second. I'll get the information correct. SSDI, continuation of Medicare coverage on page 31. So I'm just going to read this real quick just so you can get a sense of what's in the Red Book. What is continuation of Medicare coverage? Most persons with disabilities who work will continue to receive at least 93 consecutive months of hospital insurance, Part A, supplemental medical insurance, Part B, if enrolled, and prescription drug coverage, Part D, if enrolled after the 9-month trial work period. You do not pay a premium for Part A, although cash benefits may cease due to work. You have the assurance of continued health insurance for 93 months. That's 7 years and 9 months. That's a pretty extended period of time, pretty long period of time. So how do you qualify? You must already have Medicare and be working at SGA, but not medically improved. So that's available to you. And I'm not going to get into the details of the other Medicare program, but look in the Red Book. Look at the details for that. It's easily accessible. And then I want to tell you about a great program that New York State has made available to SSI and SSDI recipients, as well as other people who have disabilities. It's called the Medicaid Buy-In Program for Working People with Disabilities. And again, it's available from New York State. It allows workers, and you have to work to get this benefit, it allows workers to earn up to $55,000 a year in New York and maintain Medicaid without any premiums. The program was designed originally to include premiums, but at this point, they don't have any. They haven't figured out how to make that work. So there's no premium. It's a no-cost program to you. $55,000 is even, we're doing okay. We're still not in living in a penthouse overlooking Central Park, but $55,000 in New York State is okay. It's pretty good in many cases, and you're able to maintain those benefits. The great thing about Medicaid is that for some employment situations, you can bypass the employer-provided health plan. In some cases, people get extra pay in their paycheck or get extra vacation time by maintaining the Medicaid. So that's something to think about. But again, the rule is here that low-cost and even no-cost health insurance is available for workers. And this should relieve a lot of anxiety for people who are worried about losing this important benefit. Okay. All right. I'm ahead of schedule, I know. Getting to rule of thumb number 5, getting to the end here. But
that's okay. We've got a lot of questions.
Okay. All right. So rule of thumb number 5, the final rule here. And this is it. This is the big one. If you want to go to work, go for it. Go for it, go for it, go for it. Because there's a safety net behind you. And that's Social Security. Social Security wants to see you succeed. It does not want to see you fail. They want to see you succeed. So go for it. If you want to work, go for it. Be thoughtful about it, but go for it. Okay, so let's talk about some of the details here. So the safety net for SSI recipients is a program called Reinstating SSI Eligibility Without a New Application. So why is this important? Because we know, Tony said at the beginning of the presentation, that people spend, and sometimes up to a couple of years, maybe longer, to get on these benefits. So the idea of working enough to lose the benefits is a real problem for people. They're so scared of losing the benefit, the eligibility, that they forego possibly a better quality of life just to hang on to these benefits. But what we're telling you here is that there is a safety net, and this benefit, this work incentive for SSI recipients, allows you to really test your skills. And if something doesn't work out because of the disability, within a year of initially losing eligibility for cash benefits, you can get back on SSI immediately without an application. So there's a way to get back onto SSI cash benefits immediately without having to go through the lengthy new application process. And I say lengthy, and I shouldn't say, because we know that John and Joe and Tony have gone throughout the state with their myth, tips, and tricks training to enlighten people that it shouldn't take years to get on Social Security benefits. It should only take up to 90 days, really. So check out that training when you have a chance. It's a 2-day training. It's a great training when it comes to your area. So the next safety net piece I want to tell you about is for SSDI recipients. And you folks have what we call the extended period of eligibility available to you. It allows you to restart cash benefits immediately after your trial work period when earnings dip below substantial gainful activity, which is $1,010 a month in 2012. This is this extended period of eligibility is a 36-month window of opportunity that you're working, you're earning enough to lose initially the SSDI cash benefit, but anytime you earn less than $1,010, you can get your cash benefit back immediately, the whole check, the entire check, you get it back. So that's a great safety net that's available for folks. In general, well, let me get to the next one. For SSI and SSDI recipients, you have access to an expedited reinstatement of cash benefits. Should the disability, the original disability, affect earnings ability, you have a 5-year window of opportunities to get back onto benefits should your earnings suffer because of the disability. Benefits, in many cases, can start immediately, and they'll continue for a 6-month period of time while they re-examine your need for the SSI or SSDI. But you can, in many cases, get back on the benefits immediately when you let Social Security know, of course, your earnings have changed. So again, this is the safety net. Social Security wants to see people succeed. They're not going to pull the rug from under people. You know, once you start earning, you know, above a certain amount, you're not going to lose all eligibility. Social Security is there for you, and they want to make it easy for you to go to work. So that's why the safety net is there. You know, I want to say, and I meant to say this earlier, one of the most common questions that I get in this presentation, and I think anybody who does any benefits work gets, is how much money can I earn without losing my benefits? Even if I go through this whole presentation, that's the question. How much money can I earn and still keep my benefits? I don't have an answer for that. The information is there for you to decide what that is. For SSI, it's a pretty straightforward formula, but I can't tell you what that number is. What really the message is that people can work. No benefits counselor should be telling people that they should only earn this much or earn that much. We should make people aware of the information, what the trial work period trigger is, for instance, what SGA is, for instance. People should be aware of those numbers, and you've got to make a decision yourself whether you want to really push your limits and pursue full-time independent work or not. It would be unethical to tell an SSDI recipient, for instance, that you can earn this much and still keep all of your check. That's really unethical, and it shouldn't be done by anybody in our system. Nobody should be telling somebody, well, if you just keep it below, you'll be okay. You'll be able to have your your cash benefit and your earnings and really make out. That's not the message. The message is you've got to make a decision. For SSI recipients, the decision is sort of made for you because the more you earn, your check goes down just a little bit more. And so the decision is being made sort of with you and for you. For SSDI recipients, it's harder because it's difficult, especially that we know some people who have fairly large SSDI checks, monthly checks. For instance, $1,200, $1,400 a month. And so the idea of losing eligibility because your earnings rise above $1,010 is difficult to imagine, because say you're earning $1,100 a month, you lose eligibility after a trial work period, of course. It's hard to compare the two. It's hard to imagine trading in $1,100 for $1,400, for instance. But the real message is, it is a decision. It's not an easy decision, but it is a decision that you have to make. It doesn't mean that you are limited to only earning $1,100 a month, $1,200 a month. Certainly, the more effort you put into it, the type of job and so forth will increase your earning ability. And I should say that early in the presentation, I talk about. I'm going to go back here a little bit. About work and that people can work and so forth. I don't want to give people the idea that you just simply go to work and great, you've got your life and you're independent of benefits and so forth. I know it's not easy. Finding work isn't easy. Getting work isn't easy. Getting the job isn't easy. Keeping the job isn't easy. These are all stressful things. I don't want to make mislead you to think that you just get a job and everything is rosy. It is a lot of effort, a ton of effort. It'll feel like like climbing Mount Everest, but it is worth it. That's what I would say, that it is definitely worth the effort to try to make an independent living. I would say that. So just going to go back. Just talk about resources just for a moment. The back page of the pamphlet includes quite a few resources. They're very basic resources, but they're very good. Actually, I should bring it up, I guess. Give me just a moment. And I know it takes a second for this to pop up on your screen. But you can see, hopefully by now,
Yep.
that on the back page, the helpful resources, there are a number of places you can go to get more information about everything I talked about. And I should make this a little bigger, maybe. For instance, you go to Social Security's website. You can check out their Red Book. You can check out all their pages on the work incentives. For more information about the Medicaid buy-in, you can go to New York State Department of Health's website for more information about that and how to apply. I would say this, I should have said this about the Medicaid buy-in, that when you apply for it, you got to go down to DSS to apply for it. And because most local DSS workers, frontline workers, don't know about this program because it is underutilized, you have to write in big bold letters on top of that application, Medicaid buy-in for working people with disabilities. So just a hint for folks who are applying for this. Go down to the Department of Social Services and write those letters on top of the application. So then there's information about the Ticket to Work. This website is specifically for recipients of SSI or SSDI. There's one available I didn't include for providers. There's also a 1-800 number for people who don't have access to the computer. But additionally, there's the SSA website. New York State, we have quite a few programs. The New York Makes Work Pay website is a great resource for all this information, as well as training that's available, and much more information about work in general. The work incentive planning and assistance that I mentioned earlier, there's a website here that will bring you to information about WIPA providers in your area. So as you can see, you can just click on there and scroll down to New York and look for the WIPA providers in your area. Here are some, and they're very basic job resources that are out there that are available, including the Labor Department, New York State Labor. Their website, another website they operate called New York Career Zone, Job Zone, and a newer tool that we've developed in New York State, a joint project, 7 different state agencies. It's called the New York Employment Services System. It's going to, when it's fully up and running, it's going to be a great way to find a job for many people. That's going to be a terrific resource, and it already is, and you should check it out and see what's available. But more basically, and I'm going to go back to the presentation. This is the information there. This is how to get in contact with me. But in the different regions, you can see that there's my counterparts are available to you. They can point you in the right direction, if not answer your question outright. So we got Liz Patience in Central Region. We've got Mitchell Klein in Hudson River Region. We've got Celia Brown or Digna Quinones in New York City. And finally, we have Randy Hill in Western New York, in Buffalo area. Of course, you can also reach our main number up in Albany. But this is, and this is for Long Island people. I'm willing to come to any Long Island region place to present this workshop in person. So if you'd like that, please give me a call and we'll schedule something for you. I'm willing to talk to providers, family members, government people, as well as recipients, people who use our services. So I'm available for Long Island, and I wanted to let you know that.
Doug, could I just
go
back to that slide for a second?
Okay.
I did want to just point out something to folks that that there's a lot of information. This is a very big thing that we're talking about. So we, if people are interested in becoming benefits specialists, we do have that training available for free. It is an 8-week online course. It's 2 times a week for a 90-minute session, 2 times a week. So that's 3 hours a week for 8 weeks. However, the spaces are limited, and we do need to have people sign up for that ASAP. So to do that, call that top number there, the 518-473-6579. Ask for Joe Swinford. I've already made him available and given him a heads up on this, so you can call him and register that way. Also, you'll be getting an email in a couple of hours, and that will have his information in there as well. So I just wanted to put that out there for folks who would like to follow up and get into a lot more detail around this stuff.
Yeah, thank you, Tony. That's great. It will help people really understand the nitty-gritty of all this. There is a lot of information, but the basics are really simple. And I just want to review that really. To go over the 5 rules again. 1, people with psychiatric diagnoses, labels, can work and earn an independent living. 2, earnings from work can and do affect cash benefits, but that's not a bad thing, and you just have to be thoughtful about it. It's not so bad to get off of benefits. Number 3, Social Security will invest money in your potential to work and earn. Vastly underutilized. Number 4, really important service benefit. Low cost or even no cost health insurance is available. And number 5, finally, if you want to work, go for it. Go for it, go for it, go for it. There is a safety net behind you. People want to help you and see you succeed. That's the message, really. Be thoughtful about it and go for it. So thank you, guys. We are going to answer some questions now. I guess there are. How do we want to do this, Tony?
Well,
you want to feed them to me, or
what I'll do is why don't I feed you the questions, because I've been monitoring them throughout, and there are some that are, group them into themes. And then if there are any questions that we don't get to today, or if they sort of extend beyond the scope of this training, and they're sort of detailed and specific, what we'll do is we'll send out an email with the questions and answers. Probably give us like a couple of weeks, and we'll put that together, and we'll send that out to everybody who registered. Please make sure that you put in an accurate email address. Sometimes that people don't get those things when we send them out. Also, we are going to resend. We sent them this morning. We will resend the How to Work and Win booklet that has all of those clickable links in it. We will also send out a copy of today's training as a PDF. I did send that out earlier today. Some people had problems with it, but I think it was okay once I sent it out as a PDF. So you'll be getting all of that. You'll also get the link to the archived version of this, so you can share it with other folks as well. So that answers a lot of questions right away. If you could go to slide number 4, this one generated a lot of interest and some specific questions that I wanted to group together.
sure. There you go. Is it up yet? No.
Let's see.
Takes a second.
No, that's not the one.
No.
Go to the next slide. I must have written it down wrong. And I'm not sure if that's the one or not, but the question is about taxes.
Right.
And are there, okay, yeah, right there, that's it, number 6. I must have looked at it wrong, I'm sorry. Is that before or after taxes? Are there taxes deducted from these earnings? That's a big thing that many people pointed out.
Well, that's a good question. These are pre-tax numbers, definitely pre-tax numbers. So you certainly do when you're talking about the end of the month, what you actually have in your pocket or bank account. These are pre-tax numbers. So this slide and the next slide here, your figures may be after taxes may be a little bit different from this, or maybe a little bit lower. And it really depends on, when you're earning this little, your tax rate isn't, huge or anything, but it is something to consider, certainly.
Okay. Now, is there anything? This is just my question. So, is there anything with the earned income tax credit that would be helpful? Is that related?
Step beyond my
okay.
my area of expertise. I don't want to step into taxes too much.
Okay. I do know, I know that there's a lot of folks who don't take advantage of the earned income tax credit. I just don't know if it's related to this in any way at all. So, it is tax season. So for people who have not done their taxes, I would really encourage you to follow up with that, because you may be due some money that you weren't aware of. And let's see. Alrighty. Let's see. So these are some of the early questions. If you're going to be presenting on the Medicaid buy-in plan here, please mention that you're supposed to do it what you're supposed to do if you're 65. I understand that goes up to 64, and this person is 65.
Okay, well, that's a good question, and I think that's one of the questions we'll have to defer at the moment.
Okay.
And get back to people on. That's a good question, though.
Okay. Another question that comes up fairly commonly is people asking questions about the past plan. People asking questions about starting their own business, and I think those two things could be related to each other. And so, do you want to talk a little bit about past plans?
Well, certainly in terms of self-employment, you have to be perhaps more thoughtful about how you go about that. I've been actually learning a little bit. I've had a question recently about independent contracting and self-employment, and I'm looking for some answers for the woman who called me about this. And there is some sense that if you are starting a business operating independently, that in some cases, even when you're not earning, you're just doing the work, you're not earning, Social Security looks at your efforts in some cases. And so I have to get more clarification on that. But the past plan, and I'm going to open up the Red Book. And
so while you're doing that, I'll just throw a little promo out there. So if you do go to the New York Makes Work Pay website, I believe that if you go to passonline.org, there's a whole stuff on there. There's a bunch of great information on there about PASS plans, and let me just make sure I've got the right. Well, I'm not going to be able to find it quickly. So, but yeah, if you go to the passonline.org, you should be able to find there's a bunch of great tools on there. There's a bunch of great information on there. I believe there's some archived webinars on it as well. So that's a great excuse me, a great tool for people to develop a business plan and to become more independent. And for people who are want to start their own businesses, it's a great thing.
Tony, is there a specific question about past plans that people?
I think it was just more people looking to just some more general information about it. Did you? We do have some questions about IRWIs. Did you talk about IRWIs at all?
No, I didn't actually. I didn't include that. That's specific. We'll give it a try. Throw me a question.
Okay. So what does IRWI stand for?
IRWI stands for Impairment Related Work Expense. And what that means basically, is that you can, if you have an expense that's not otherwise paid for by insurance or any other expense related to your disability that enables you to go to work. For instance, some people on SSDI may not have complete coverage for their medications. So if you're paying out of pocket for some medications, and you need that medication to get to work to make you, to help you get to work, you can deduct that when Social Security figures your countable income, your earnings income. So say you're earning $1,200 a month and you pay out-of-pocket expense of $200 a month for medication. You can deduct that expense from your earned income and you'd be down to about $1,000 a month and you'd be under SGA and so forth. There's more information in the Red Book. I hope that does answer the question, though, basically. Mm-hmm. That's basically an IRWI, an impairment-related work expense. It's an expense that helps you get to work.
Okay, I wasn't paying close attention because I was still scrolling through.
Okay. So that's the basics on IRWIs.
Yeah, just to jump around a little bit, and I apologize for some of the disconnectedness here, but so when we were talking about on page 6 about those how those things are taxed,
Mm-hmm. Right.
And I brought up the earned income tax credit. We are fortunate enough to have Edwin Lopez on the line, and I hope he doesn't mind me outing him a little bit. He's one of the trainers of that 8-week training that I was talking about, and I had the pleasure of participating in that with him and Ray Sabula. So what he mentioned was that the taxes paid come back to you when you file for tax refunds, and then you can also apply for the earned income tax credit, and that gets you back what you paid for FICA. Thus you get them all back, and that is what Edwin Lopez is saying. So that's a good thing.
Thank you, Edwin. Yes.
Now a couple of things around um, philosophies and whether or not somebody can work. So a person here is saying, well, what if you've been told that you can only do volunteer work? What do you say to them?
Well, you know, you make the decision about what you want to do. The question is, do you want to work? Do you want to, your efforts, do you want to get paid for your efforts? It's great to be a volunteer. I think there's so many things you can say about volunteer work, and none of them are negative. However, you know, if you want to make a living with your energy beyond volunteering, you know, you've got to make that decision. And I'm not sure who's telling you that you can't work or you shouldn't work, but I can't. And I've thought about this a lot, and I've asked a lot of people. I can't think of a reason why somebody would tell another person that they can't work or they shouldn't work. Yes, stress and you know, how these intense work environments that some of us work in affect our lives are great. And the purpose really of our mental health service system is to help people deal with those things, is to help people figure out how to maintain ourselves and deal with the stresses of work and the situations that we come across in the world. So, you know, we do have a purpose. We're not, the mental health system isn't simply to treat mental illness. That's not our purpose. Our purpose is to help people, you know, create a meaningful life for themselves. And work, for most people, I would say, is part of that meaningful life. I would say the vast majority of people do want to work. And so the obstacle, we have to figure out where the obstacle is. And, you know, if our clinical team is telling us we can't work, what do we do with that? I can't tell you. Do we find another one? Do we find some people who can be more supportive and who are more aligned with the goals that we have for ourselves? Perhaps that's one way of looking at it. I can't tell you that you should work. It sounds like you do want to work, and I would say that you need to find people who can support that.
Well, if you don't mind my adding, so if we're talking about stress, and I don't know if I can speak for everybody on this, but I can tell you that for me, you know, the stress I had when I was poor was much greater than anything I've had while I work. And you know, and this job is fairly stressful, but you know, there's always going to be stress in your life. But how stressful is poverty? You know, how stressful is that? And you're already dealing with stress, so you know, why not have, you know, a higher quality of life and deal with stress, you know, with cable television or with, you know, with some other things that make your life a little, you know, a little more easier and a little more enjoyable. And the other thing too is when we are in those positions, you know, work offers us a tremendous amount of independence. And you know, you know, for people who are not working, I mean, you really, in a lot of ways, you are really subject to being told what to do. You know, and you're really being put in a position where you have to listen to other people, and you're dependent on other people. And you know, for some of us, that's not a good place. For some of us, that is what is described by T.S. Eliot as the wasteland, and it's not really a good human life. And I would hope that people don't believe that. You know, when you listen to people who are successful, there are people in their life who have said they aren't going to amount to anything. They are, you know, even parents, you know, because one of the people here, what if it's a parent that tells you you can't work? I mean, even parents will tell you you're not going to amount to anything. You know, you're a loser, you're lazy, you're this. You know, I've been called these things, and you know what? You know yourself better than anybody else, and you know you don't have to listen to these people. You know what you're capable of, and you're probably not going to get very far in life if you don't believe in yourself. So I would encourage people to start believing in themselves. And I know that's very, very simplistic, and I know that that's very much easier said than done. So I don't want to minimize that at all, but it is, and I think it is a very basic truth.
Yeah, I think it would be great to hear some more about that, and if you can, you know, email us afterwards or talk to us, or use the chat function to give us some details about what you're facing, who's telling you that you can. But thank you for the question.
Yep, and like I say, arm yourself with information. Supported employment is an evidence-based practice recognized by SAMHSA. We don't have to be symptom-free. I think that that's one of the myths that people work for, is that you have to be free of symptoms before you can go back to work, and that's unrealistic. There's a lot of people who have active symptoms and are doing quite fine in their jobs. I think the let's see. Well, I've lost my train of thought here. So.
Okay. It's a big question, I know, and a lot of people struggle with that. But
Well, so I'm sorry. So going back to things like volunteering, just another thing to keep in mind that when I've spoken to people, and maybe this is your experience too, Doug, is that when we speak to people, sometimes people want to start off, as the CEO of the company, and that's not realistic either. Most of us have started off by volunteering or by taking, one of my first jobs was a dishwashing job here, and that's where you start networking. And we know that most people get jobs not by what you know, but by who you know. And once you start networking and getting out there, and people recognize what you're capable of and how good you are, more and more opportunities are going to start to open up for you. So I think that's what we really need to remember too, that you don't have to start off at the top, and there's value in volunteering, there's value in networking. I think that's a very common and almost universal experience. Most of us who have been working for a long time could always look back and see that we've run into people that have helped us along the way.
Great, thank you, Tony.
Okay, so somebody said I beat them to the punch on the issue of stress, so that's good. Let's see. Can you go over the ticket to work?
Okay, the ticket to work. Okay.
If you don't mind, while you're
I'm going to start. I'm going to always start because this is the resource. I'm going to start with the Red Book and start with their language here. Is there anything specific about the ticket to work you're looking for, or?
No, it just says, can you go over that? So,
okay.
Doug, if you want to talk about maybe a little bit about what it is and how it applies to things like SSI and what it means, and then maybe I could talk a little bit, or if you want to talk a little bit about how it applies to the NICE system.
Okay. So I'm reading right from the Red Book. The Ticket to Work program is an innovative program for persons with disabilities who want to work and participate in planning their employment. A ticket increases your available choices when obtaining employment services, vocational rehabilitation services, and other support services you may need to get or keep a job. For you, it's free. It's a voluntary service, but you can use your ticket if you choose, but there's no penalty for not using it, I guess. Where can I use the ticket? And this, again, is in the Red Book. The program is available in all 50 states. Many SSDI and SSI disability beneficiaries will receive a ticket they can use to obtain services from a state vocational agency like Access VR for New York. We call these approved providers employment networks. And I provided you with a website and a 1-800 number. That's actually 1-866 number that you can access to get more information about this and to find out who the employment network providers are in your area. We are, if this is what you're referring to, Tony, with the NICE, New York State is working on an agreement with Social Security that would enable really New York State to be an employment network. So any of our licensed providers would be able to help you put your ticket into action. But it can pay for a number of services that can help you get to work, whether it's helping you put together a resume, whether it's job coaching, all kinds of those type of vocational services. Job Coach and other types of employment supports like that can help you deal with the stresses on the job and off the job, maintain your ability to keep a job. I mentioned the $23,000 worth of services. There is a milestone program, and I hope I get this right. When you start working a certain number of hours, or the employment network gets paid for helping you to get to work. When you're able to maintain that over a certain amount of time, the employment network gets paid again. When you increase hours and get to full-time work, the employment network gets paid. And this employment network is ostensibly helping you and supporting you and helping you figure out how to increase your hours, how to maintain yourself. So when you're working full-time for a certain amount of time, again, the employment network gets paid. That's how the ticket works, basically. Did you want to add anything, Tony?
Yeah, I'm going to take the presentation back, and I just want to show folks something that I think might be helpful. So what Doug was saying about the employment networks, and yes, we have New York State is now the first full state in the country to have an agreement with Social Security Administration, and we are now an administrative employment network. So to answer one person's questions, no, you don't need the physical ticket to participate in this. You can show up to any of the participating agencies in what we call the NICE system, and that is what I have up right now, although I have it under the customer information. But if excuse me, if you go to the home page here, on the home page you'll see that it says current participating providers, and I know it hasn't been updated since October 25th, but it really hasn't changed much since then. So if you click on that, you'll see there's the whole list of all of the agencies, and there's approximately, I'm not going to go through all of these, but there's approximately 250 agencies that we are working with right now. All of these people are now part of the employment network. They have an incentive, a monetary incentive to help people get jobs. A lot of that money in the past has not been realized because they haven't tracked people. A lot of times what happens is, we get a job, we do well on the job, and then we disappear. But now, for the length of time that we stay on the job, they get more incentives to do that. So any agency that promotes collaboration, so any agency that helps a person to get a job will get reimbursed based on the activities that they do. What this means is that we are going to be able to bill the federal government through the Ticket to Work and these employment networks. We're going to be able to bill up to $1 billion a year, and that's B.
A lot of people use it, right?
Yeah, billion with a B. So, and that it has been estimated that we've been leaving hundreds of millions of dollars on the table for people who have been working, and we have not gotten reimbursed for the help that we've done for that. So that's the good thing, because if you want to know how something works, you got to follow the money. There's money behind this to help people get jobs. So that's one of the really good things. There's another page here that I wanted to throw up to folks, and this darn control panel gets in the way of the scroll bar. So hang on. If you go to the customer information page, there's a lot of the same stuff that Doug had pointed out on his week, how to work and win. There's some videos on here. There's a couple different things on here. So there's the Week and Work video right here. Doug's How to Work and Win is on there as well. You've got the New York Makes Work Pay website. That's a clickable link right there. You've got the Disability Services Locator, the Ticket to Work. So if you want to find out more about the Ticket to Work, that's right there. So a lot of this is stuff that you're going to have to, go back and follow up on your own. There's plenty of folks out there that can be helpful, and these are some great sites to start. Medicaid buy-in is right there. And I think beyond the label, something that I don't want to get into right now, it's more for businesses. And then general information for people with disabilities. And then another question, and I'll throw it back over to you, Doug, was the 2-day training. So if you go to the Office of Mental Health, if you go to the Office of Consumer Affairs under training, this is what Doug was referring to. This happens every month. It's a 2-day training. The next one is at South Beach. It's a very intensive 2-day training. And I've been to several of them to assist the presenters, and every time I leave, my head is spinning, and it's very, very intense. So, and it's very, very helpful. Okay, so let me go back, do some more questions. Let's see. So a lot of people are asking just about the information. Are we going to be sending it out? And yes, we'll be sending this back out to everyone afterwards, everyone who registered. And then there's some very specific ones here too, like can I get money to fix my car to go to work if I'm on SSI? And I'm not sure if I can cover. I'm not sure if we could cover that right now. I'm not sure what the answer is.
Well, there may be some something with the past plan with that. It may not be enough, but you know, there may be something there. You know, but there may be some more local things that you can look into that might be more helpful. If you check out some of the resources in the county you live in, or the service providers, maybe they can help. But I may be stretching it a little bit, but maybe, you know, people have used the past plan to purchase cars so that they can get to work. You know, so you know, you got to look into these things a bit and study them, but that might be something.
Okay. And then there were a couple of questions about, are there incentives for employers to hire people with disabilities?
Well, right. I think you pointed to the New York employment support system. That's working with employees to offer incentives, and you probably have more details about that than I do. But there are, yes. That's the thing beyond the label campaign and so forth.
Yeah, there are. We have been working with the Business Institute here, and so one of the things that the NICE system does is it'll pre-populate the tax incentives that are available to employers, so they don't have to deal with all the paperwork, because that was one of their big complaints, was that, you know, it's a lot of paperwork. The other concern that people had, that employers had, was that if they hire someone with a disability, that's going to shoot their insurance rates through the roof. And the counter to that is that, well, you know, for people with disabilities, the Medicaid buy-in is available. So people would be on Medicaid, and they wouldn't even be using the insurance. So, and then someone asked if there's a cost. Do you know if there's a cost for the Medicaid buy-in?
No, there's no cost. You just have to work.
Okay. Now, my understanding is that there's no cost because they haven't figured out how to bill for it yet.
Right. There's some kind of computerized, which I don't know the details of, but they haven't been able to figure it out. And it doesn't look like they're going to be doing that anytime soon. So
right. There may be a cost someday, though, but certainly not in the near future.
Yeah, not in this year.
Mm-hmm.
And so it's a great time to take advantage of it.
Cool.
Even if there were a premium, they're very minimal anyway.
So, like I said, what we'll do is we've captured all of the questions that were written in. What we'll do over the next couple of weeks is answer them as best we can in writing, and then we'll send that Excel spreadsheet back out to everybody, so you'll get a good Q&A, because it's really too much to cover in an hour and a half. But I think this is a good starter for a lot of folks, and I think we've given a lot of good information out to people to take it and run. To take it and run with it. Oh, excuse me again. The one thing that I would say, and then Doug, I'll ask you if you have any closing thoughts, is, there was another person on there that said, my dad said I should just volunteer and I should stay on SSI and SSDI, and I would encourage you to attend, one of these and bring your dad with you to one of these trainings that is up on the screen now. One of these 2-day trainings, to go online, to get other information, to talk to other people, to go to some of the agencies that are out there that I had listed in your area, and to just get some more information on that, because for a long time that's what we used to think, but the common knowledge of the day has changed dramatically. It has changed dramatically. I mean, this is on the scale of a Copernicus, Galileo kind of thing, where the Earth is no longer the center of the universe. We twist around the sun. So we gotta start thinking in different terms, and there's a great deal of help out there to help people get back to work and find good, meaningful lives. So, Doug, did you have anything else you wanted to say in closing?
Yeah, give me back the screen, and I'd just like to put that one screen up again.
Alrighty.
Do I have to do anything?
Just send it over.
There we go. Show my screen. Yes. Thank you, Tony. I just want to put this up again. I tried to make this information accessible with these rules, these 5 rules. I want you to be creative with it. If you don't think it's meeting your needs, be creative with it and create your own. I think that's the idea, is to get the word out that people can work, and that if you're thoughtful about it, work is very possible. Getting off these benefits is possible, and it's not a terrible thing to be on benefits, but most people, and I would say the vast majority of people, do want to live independently of the mental health system, independently of the social service system. And we want to encourage that. We want to help people get there. Removing the anxiety about benefits is the purpose of this presentation. I hope we've done that. Certainly we've provided you with a lot of information. And you have to be thoughtful about it. You have to go through it. But once you do, once you make the effort, you'll find that you are more informed, that you can be thoughtful, and you can let go of the worry. And so you can work and win without worrying about your benefits. And so that's the message, guys. Go for it. Thank you very much, New York.
Thanks, Doug. Thanks a lot for being assertive and really being looking to do this training, because I hadn't reached out to you. You actually reached out to me, and we're really pushing to do this. So I'm really glad that we were able to do it. If you don't mind, could you scroll down to the last slide for me? I want to let people know that this was the largest webinar of our monthly series that we've done, and we've been doing them. This is the beginning of our 4th year now, and this is the biggest one. So clearly employment is something that people are very interested in, and I think eager to get more information about. I want to remind folks that when we end this webinar, there will be a window that will pop up with a short survey. If you could just please take the time to fill that out. It's only like 4 questions. And then if there's anyone there that participated in this that did not register, if you could please just put their names down, so we can, there'll be a space there for you to put their names down, and that way we can get certificates out to them as well. And if for some reason you have a pop-up blocker and you don't get that window, you'll get an email from me. You can just send me an email and I'll take care of it. But I would prefer, it's easier for me if you could just do it through the survey at the end. And just for an announcement for our next webinar in March, we're going to be shifting gears a bit away from employment, and we'll be talking about the New York State Office of Mental Health Annual Consumer Assessment of Care Survey. And I don't think we've ever really publicized this and talked to the general public about it, but it's something that OMH does every year. As of last year, we started putting the information up on the website, and so we want to talk to people, let people know what it is, where the data is, how it might be useful for advocates, how it might be helpful. So I put the web link up there for you to take a look at last year's Consumer Assessment of Care, and also the link is there for you to register for the March webinar. Obviously, when I look at this, I failed to note when it is. It is March 7th, and I apologize for that. It is March 7th, and it is also from 1 to 2:30. So it'll be March 7th. That's a Wednesday from 1 to 2:30. thank you everyone for coming, and have a good day. And Doug, thank you again. I really appreciate it. Bye-bye now.